Hello and welcome to another episode of Local Expert Interviews. My name's Michael Grady, and today we're going to be speaking with Dr. Goswami of Precise Care in Newport Beach, California. Dr. Goswami has a unique training background in two specialties, surgery and medical imaging. His combined expertise allows him to perform medical procedures that offer patients opportunities for better health without invasive surgery. Welcome, Dr. Goswami.
Hi, Mike. How are you?
Very good, sir. Dr. Goswami, please tell our viewers a little bit about yourself and your practice in Southern California.
Well, our practice is based in Orange County in Southern California. We have two locations, one in South Orange County, Newport Beach, our primary location, another location in North Orange County in Fullerton. My training background, as you mentioned, has been in two different medical specialties, surgery and medical imaging. And as medicine evolves, there is emphasis on doing procedure less and less invasively, and there are some very unique treatments we can offer now to patients, which can be done in the comfort and privacy of an office setting, just using local anesthetic for anesthesia purposes. So that's been my focus and area of interest, is to provide cutting-edge treatments that don't require a visit to the hospital and can be handled outside.
Well, let me ask you a general question. As an expert and someone who's been in practice for many, many years, what advice would you give someone who's looking for a cosmetic procedure?
Well, I think the most important thing is obviously to check their credentials. You want to make sure that they are board-certified physician. But I think the most important thing, if I was looking for a doctor for myself, would be what kind of rapport you're able to establish with that physician when you go in to see. You first of all feel comfortable expressing yourself, laying out the goals that you have. So I think that's very important. See what kind of response the physician should be able to answer your questions. So you should be able to question them about their experience. You should be able to question them about their before and after images, and in general, get a good sense of whether this is someone who understands you and your goals and is willing to deliver on those goals.
Let me ask you, as a leading physician, what's the most important thing that someone should be looking for to make sure that they have a positive outcome? Is there one thing?
I think the most important thing is the thoroughness of the evaluation. How much time does a physician spend before doing a procedure? I know of, and we've all come across a lot of physicians who technically might be very superior, but I think you have to manage a patient as a whole, even when you come for cosmetic procedures. So it's very, very important that how thorough the evaluation is, how much time the physician spends with you before even deciding on a procedure or trying to do a procedure, and how thoroughness is your medical exam and making sure that there are no other conditions that could potentially pose some risk to you during the procedure.
That's all very good advice. Let me ask you a little bit more specifically now. What's the most popular procedure that you perform?
Well, our area of focus is varicose vein treatments and liposuction. Those are the two most commonest procedures in our practice that we currently offer.
The varicose veins, are those spider veins?
Well, there is a whole continuum of leg veins. The tiny, thin red veins that we see on the skin surface are called spider veins. But this may or may not be associated with bigger veins inside the leg, which may not be visible to the eye, or they do become visible when they really become severe and they're big bulging veins on the legs. Those are called varicose veins. But usually it's a spectrum. Most patients are likely to have a combination of both.
I see. Well, let's talk about the varicose veins. I understand from your procedures there's very little pain involved in the procedure. Is that correct?
Absolutely. Over the years, the technology has really advanced. I mean, this was treatments used to be done under anesthesia and under surgery, where the philosophy at that time was to literally strip these veins out of the leg, and then it was a very traumatic procedure. The leg had to stay bandaged. Even after the patient came out of anesthesia, they would have significant amount of pain and discomfort, not only for a few hours but for many days. That has now been replaced where we try to sort of fade these veins or dissolve these veins inside the leg itself, and these modern treatments are done in the office setting again. Patient doesn't even need to bring anybody with them. They walk in, walk out, they're able to drive. So there is hardly any discomfort. I wouldn't say that they're totally painless, but it's hardly any discomfort involved.
Well, let's talk a little bit more about the recovery period then. Somebody can come in, have the procedure, and leave on the same day. Can you kind of talk through what happens when they're going through the recovery?
Well, one of the most important things, and that's what we also go over with them in our initial consultation, is compression garments. You know, both after liposuction and after varicose vein treatment, it's very, very important that they have good fitting compression garments. And in terms of recovery, if you were to ask me, patients are up and about, but they are wearing those compression garments, which are very important in the first few days following the procedure. But there's not really any restriction on routine activities. We do tell them to take it a little bit easy as far as heavy, intensive exercise or lifting some heavy things, you know, for a few days. But that's about it. Both of these procedures don't involve any skin incisions or stitches per se. We work through very tiny skin holes, and patients are up and about, walking, even as they're recovering from the procedure.
Now, I understand that some other physicians actually prescribe those compression garments. Do you provide those?
We do. We actually provide them in-house to our patients because over the years we realized since compression was such an important part of the treatment, it's not just doing the procedure and leaving the patient. Since compression was so important not only in their recovery but also in their ultimate outcomes from these procedures, we realized that the best compression is the one that the patient likes and it fits them. So we have a certified compression fitter in our practice. She goes over the measurements of the patient, shows them different fabrics, help them decide, because we really want them to keep these compression garments on. And you know, if they don't like it or if they don't fit them properly, they're less likely to use it. So I thought it was important that the practice itself took care of that part of patient's recovery.
I think that's very thorough. You know, I know you take excellent care of your new patients, but let's say someone was looking to have varicose veins looked at by your practice. Are you currently offering anything for a new patient?
Well, I think one of the most important things that we offer to our new patient is the initial consultation. And when I say the initial consultation, I mean it's complimentary and free. It's not a 10-minute walk-in where I just take a cursory look at their legs. You know, our consultation is pretty exhaustive. The patients usually spend about an hour in our office. You know, they will obviously meet with my nurse, with my assistants, and I go in, I take a look at it, what their concerns are, what their goals are, and I also include some imaging. Since I'm big on doing this procedure under image guidance, I do the ultrasound, and I specifically have always liked doing the ultrasound myself so that I can really kind of make a roadmap of what kind of treatment I'm going to offer to the patient. And then we obviously measure them for their compression garments. So that, I think, is the crux of our practice, and then that is free and complimentary. The patient's under no obligation even to sign up with us. My goal always has been that by the time the patient leaves my office, they have a good level of understanding of what they're looking for, what the procedure involves, irrespective of whether they want to come back to us and get it done here or they go anywhere else. It's more about giving them all of that knowledge that we, you know, briefly talked about in this interview, so that they can make an informed decision.
Dr. Goswami, I want to thank you for being on this interview. You've given our viewers a lot of really great information about varicose veins.
Thank you. Thanks for having me.
Again, my name is Mike Grady. This has been another episode of Local Expert Interviews. We've been talking to Dr. Goswami of Precise Care in Newport Beach, California. If any of our viewers would like more information from Dr. Goswami, please refer to the phone number at the bottom of the screen. Again, thank you, Doctor.
Thanks, Mike.